Welcome to today's episode of Vestibular Talks. Today's special guest is Danielle. Danielle is a successful physical therapist that has created an interactive community online called Vestibular Today. It's about medical and health wellness, and they discuss vestibular research, treatments, experiences of professionals, educators, and patients in order to find balance and well-being. So remember to like, share, and subscribe, and stay tuned for Danielle's episode. All right, find your happiness, guys. All right, recording. How are you, Danielle?
Good. How are you?
Good, good. Welcome to this episode of Vestibular Talks. It's a pleasure having you here.
It's a pleasure to
Um,
talk with you.
thank you. I feel underdressed because you look so pretty, and I'm all like in
Oh,
a hoodie.
this is just work attire. You're perfectly fine. You look great.
All right, thanks. So, would you mind giving us a brief introduction of who you are, what you do?
Sure. My name is Danielle Tate. I am a vestibular physical therapist. I got into vestibular therapy back in PT school, where I took a special topics class and just absolutely fell in love with it. I had the great opportunity to work with a specialist, Jeff Walter, up in Pennsylvania, and I was hooked from right day one. I actually have some family members who have vestibular dysfunction, which affected them greatly, and I have a lot of passion for working with patients with vestibular disorders because I can see how terrible and limiting it can be to their days and how difficult it can be to get through the healthcare system and get the help that they need. So this has been something that I've just been really passionate about and very much excited to learn about and really progress through my career, helping as many people as I can. So this has
Ah,
been fantastic.
thank you, thank you. It's interesting that you mentioned that your professional life intertwines a little bit with your personal life because you have some family members that have been affected with vestibular disorders.
hmm
Um, since you got involved in the vestibular world, have you been able to like provide them more knowledge and more relief, or even educate them more and walk them through the process of like, hey, this is what's happening, and maybe we can do certain things to improve?
Absolutely. Education is one of the biggest things that I think I do with patients on a consistent basis, even just out in the community. A lot of people don't truly know what dizziness or vertigo is, or that there's different types of dizziness, and that there are different things that contribute to being dizzy or having vertigo. So, in the clinic, a lot of times I'm educating patients, no, you're not crazy. What you're experiencing is something that a lot of people experience, and it's hard to put words to. So we educate them on how to put words to what they're experiencing in order to help them out at other appointments with other specialists or with other medical professionals. We talk about educating them about what exactly could be going on with them, what signs and symptoms they could be experiencing, and what to expect down the road. We educate with different ways to manage, whether it's exercises for the inner ear or eyes, or even down to diet, how diet, weather, exercise can all affect how you feel in a day, and even going out in the community. So I found that a really big thing is to arm patients with the information before it even happens to them. So I do a lot of free presentations wherever I'm living or wherever I'm asked to go to just discuss dizziness and balance and vertigo, and one of the most common causes of it called Bppv, where you've got these little crystals that become displaced. And there's a statistic that shows in an older population about 1 in 10 people have undiagnosed Bppv. And almost without fail, if I have a room full of 20 people, at least 2 of them will raise their hands and say, I think I have that, or I have had that. I've done all of that. And, the therapy helps. So I think arming patients with as much information as possible is a big key, because unfortunately, vestibular patients have to be their own advocates in the healthcare
Yes.
system. Referring to one of your videos, actually, I have just realized I shared one of your videos back in January. And this is just after you had spoken to a healthcare professional who didn't believe in vestibular migraines. And it blew my mind. But it's something that we actually commonly see. And it's so frustrating because there's a whole patient population that maybe that clinician was the first person they spoke to about their symptoms. And they're basically being told they're crazy. And
Yes.
that's not it at all. I mean, it's heartbreaking to me that some people aren't getting the help they need because they either, aren't advocating for themselves, they run into a wall with their medical professionals in their area, or they don't have the resources to get the help that they need.
Very interesting. So I love the glow and passion that you have when you're talking about this. You're like so into it. So it's really nice to see. Also, you mentioned a few things that are very important. Number one, raising awareness and providing education to people, whether they are suffering from it or they haven't suffered from it yet, they might get affected by it sometime in the future. So the fact that you are educating people is great because it makes it more acceptable. It makes it for people to be like, hey, I resonate with that. That's me, or I live that. And what you mention is that they don't want to feel like they are crazy. And you tell them, no, this is real. This is a real condition. Like you're actually experiencing something that is real. And you're right. Because when you go to a doctor and the doctor is like, no, I don't think you're dizzy. I think you're just anxious, or you might be imagining it. Then you start to question yourself because you're like, well, it's just me, and that plays out to create more anxiety, more uh, fear, because you're now thinking, well, is it really not real? Is it really not happening? So thank you. The fact that you create awareness, information, and that you acknowledge patients and say, yes, this is real, that makes a huge difference. So thank you very much. That's great.
No, absolutely. It's a big part of it. And sometimes just not being able to express what you're feeling can be so frustrating to a patient that it actually starts to feed itself into this snowball effect. So you've got somebody who's starting to doubt themselves, and then they get more anxious. Well, anxiety will amplify symptoms that they could be having. And if your symptoms become amplified, you move less. If you move less, you're not going to compensate as well. So you start to deteriorate more. And the next thing you know, your quality of life is going downhill and you can't function in your day and you feel like no one believes you and you're starting to second guess yourself. And you just end up in this horrible position where you feel like nobody can listen, nobody's supporting you, and you're not feeling well at all. Even just people that have brain fog. I don't know if that's something that you've experienced, but not being able to clearly remember something or to be able to function throughout your day and feel like you can be a normal human being, that's draining, especially when it's 24/7. So, that could be very, very tough. And I don't know how you guys do it. You guys are true champions, vestibular champions, I think is what you were talking about before.
Yeah, well, let's get into. Oh, yeah, you're right. It's hard to do it, but it is doable. It's possible, and that's what I want to tell people. It does get better. I know at the beginning it's very dark because you're trying to adjust to this new reality, but also people need to be realistic with their expectations. Somebody's like, what magic pill can I take that I'm gonna be back to 100%? And I usually tell them, I don't want to disappoint you. And yes, there are medications that do help improve, but it's not just about a magic pill. You have to do your diet, be careful with the amount of stress you carry. You have to do your VRT therapy, your vestibular therapy. You have to do all your exercises and try to move and exercise as much as possible in order to compensate. And I said, and even if you do all of those things, nothing guarantees you're going to be 100% balanced again. You may have to learn to live with 90%, 80%, but be confident that you will adapt to it, that you will adjust. It's in your mindset. If your mindset is positive, you will get results. But if you're constantly putting yourself down and saying, this is my new life for the rest of my life, I'm never going to get better, that's not going to help anybody, no you or the professionals like you, like yourself, that are trying to help people with dizziness.
That's a fantastic way of putting it. I mean, truly, because, in reality, depends on what kind of dysfunction or condition that you've experienced or gone through. But a lot of the times you might not get to that 100%. It's very rare, occasionally with Bppv patients, if it's just Bppv and we do the maneuver, we kind of nip it in the bud. Yeah, they can go back to feeling okay until they have a recurrence, but they learn how to manage that and manage symptoms. But somebody with vestibular loss or vestibular migraine, Meniere's disease, they might not ever get back to feeling 100%. And I think sometimes continuously chasing that 100% feeling back to normal just drives people up a wall. It can be very tiresome. But like you said, finding that new normal is important, and you will get back to doing the things that you enjoyed to do, and you will get back to a new level of life. It won't always be this terrible dark place forever. There is definitely light at the end of the tunnel. And
Yeah.
it's just finding that area that you can get back to feeling comfortable again.
Yeah. Now let's talk a little bit about the conditions themselves. The
Mhm.
most common one, I guess, especially for people that are getting older in age, it's BPPV. Um, if it doesn't get treated, is there a chance that it will go away on its own, or you buy like you have to do the Ipley maneuver in order to find some relief?
No. So interestingly enough, the maneuvers for Bppv have only been about since about the 70s. But
Oh,
people have been experiencing this for hundreds of years. It is what it is. So it wasn't until a physician named John Epley kind of flipped the idea of what was going on in that teeny tiny organ inside your head and figured this out. And at first, all of his colleagues thought he was crazy. They tried, shunning him from all the conferences. They tried shooting down all of his research, and he persisted. And it wasn't until they finally realized, I think he's onto something. So, for a while, we never had maneuvers. It's been within this lifetime that they have just become the new normal. Now, if you say you have vertigo or you're dizzy, they go, try the Epley maneuver,
yeah,
named after the physician who came up with it. And since then, there's been a lot of different maneuvers named after multiple different people who have come up with different ways of doing them. But there is, with Bppv, there is a chance that it does go away on its own, usually after about a couple of weeks. If you can think about it, the inner ear is with my little model here. The inner ear is made up of different components, including these little canals. You've got these little crystals that hang out on the inside of the vestibular organ. They're kind of similar to bone. They're made of calcium carbonate. So just like our bones become brittle as we age, so do these crystals, but they don't regenerate. What we have is what we got. So if they start to break apart and we lay down for prolonged periods of time at night, those little crystals can collect in these canals. So if you've got these little crystals rolling around and you get momentary episodes of dizziness, after a couple of weeks, they've been rolling around enough where they start to break up and they no longer trigger the reaction of vertigo. So there is the wait and see method. And
yeah,
for some people, they choose to go that route because maybe they get too nauseated, maybe they vomit during testing and during repositioning, and they don't have that option. So you can wait it out. But by doing your maneuvers early on, you can get rid of those sensations of room spinning vertigo, which is really, really good to help decrease your risk for fall. If you think about it, usually as we get older, we tend to get up and down a lot in the middle of the night. And the way that the vestibular organ is set up, sometimes it takes a couple of seconds for that vertigo to kick in after sitting up out of bed. So you could be halfway across your bedroom when that vertigo snaps on, and next thing you know, you're on the floor and you could have an injury like a fractured hip, or you, even in your bathroom, fall and hitting your head.
yeah.
So treating it with maneuvers with early detection is probably one of the first things that we would recommend and we'd recommend doing. The wait and see method is also really great, but usually nipping that in the bud is good because you can have some complications with Bppv that make it more difficult to treat or make your symptoms a little bit more amplified. So
Yeah.
maneuvers are great, but they're not for everybody, but usually for most people.
Okay. No, thank you. Very, very informative. Danielle, okay, so myself, I took my balance for granted before. Like I never even knew we had a vestibular system,
Hmm.
and until I experienced this diagnosis of vestibular migraines, I never even knew that migraines could give dizziness or cause such of balance sensation. I've been seeing more and more people. Maybe it's because I'm involved in it now, but I've been seeing more and more people online at a younger age getting diagnosed with Meniere's disease. And I tell them, I'm like, you're only in your 20s or maybe early 30s. Have they checked your hearing? Have they done any proper testing to maybe eliminate the possibility that it maybe was maybe PPPD or vestibular migraines compared to Meniere's? So do you feel that this diagnosis of Meniere's to people is being given to many young people nowadays because the vestibular system is still so misunderstood and they just assume that everything is Meniere's? Or what do you think that people are getting more diagnosed with Meniere's lately?
Yeah. Well, you know what? I think there's been a general overdiagnosis of Meniere's for a long time now. I actually just saw a patient this week who came in and told me that she has a history of Meniere's disease going on 10 years, and she's had a recent couple of bouts, which is confusing to her because they're different. And in reality, I think she was a vestibular migraine patient. And if you look at Meniere's disease, The four main symptoms can pretty much be similar to other dysfunctions or disorders. And I don't know if you've been watching the virtual Vestibular Health Summit with 360 Neuro, but they've had a couple of really great presenters on this week, including Dr. Bay, who gave a fantastic talk on vestibular migraine, and he kind of hit on the same topics. A lot of times people will be misdiagnosed with Meniere's disease, but unfortunately there's very specific criteria that need to be met to be diagnosed with Meniere's. And typically that's diagnosed over a longer period of time. You need to have ringing in the ears, fullness in the ears, a low frequency hearing loss, and attacks of vertigo lasting anywhere from 20 minutes to 12 hours. Those are pretty specific. But if you look at vestibular migraine, these patients can have clusters of episodes that last anywhere from 5 minutes to over 72 hours. They can sometimes have fluctuation in hearing, especially with hypersensitivity. So you can kind of see where you might see some similarities and where some physicians might kind of overlap with that. But you're absolutely right. With the younger population, if they're 20s or 30s, we should really be thinking vestibular migraine first before Meniere's disease. Meniere's disease is more of a diagnosis by exclusion, and we typically only start to see that in the later population or the later age population, like 40s, 50s, 60s. We see vestibular migraine a lot more in women than in men, but again, like yourself, there are a lot of men that do experience vestibular migraine. And there's actually a bit of a traditional pattern too. With a lot of these vestibular migraine patients, they'll have either some history of migraines with head pain or visual aura starting in their 20s or 30s that tend to cluster around changes in hormones like pregnancies or menstrual cycles. And they continue until they hit menopause. And as soon as you start to hit menopause, and once again, your hormone levels start to change, you'll see a decrease in head pain. But these weird episodes of sporadic dizziness that kind of occur that you can't really figure out what's causing them, why they're coming on, but you feel better if you lay down in a dark room for a little while and let them pass. So there's a lot of education with patients about vestibular migraine, because people think migraine, they think headache. Yeah. They don't think of it just as a cluster of inappropriate neurological activity causing these physical symptoms. And they could be anything from an abdominal migraine, it could be loss of vision, or having these weird floaters or changes of color in your vision. There's hemiplegic migraines. I had this one patient who would go completely flaccid on her right side. She wouldn't be able to move her right arm or right leg when her migraines came on. So, after we do a lot of education with that, and people kind of get into denial a little bit in the beginning, but they go home, they do their research, they look at the materials that I give them, and they go, okay, let's revisit this because I think you're right.
Danielle, you hit the nail right on the head. Like when you mentioned the fact that it could be also linked to hormonal changes, because you're right. Many of the women that I've talked to that have experienced vestibular migraines usually is right after they give birth to their children. And they are like, yeah, but I never felt like this before. And then I gave birth, and a couple weeks later, a couple months later, the onset of the dizziness came on.
Oh, yeah.
I myself, I believe I had an earlier episode of this when I was in my teenage years, when I was just going through puberty, becoming a teenager, going through puberty.
Yeah.
I remember clearly that for a couple of months, I was dizzy, and I was like, this is a weird sensation, but it was manageable. And then it kind of went away until now that I'm in my 30s. I'm 34 years old. So I think it's again linked to hormonal changes. You're right. It could influence the food that you eat, the weather, wherever you're living, the weather changes, the stress levels. But yes, hormonal is definitely huge. And I really like the fact that you're so informative and you're so well aware of all the different avenues. Because, for example, if I go to a neurologist, he'll be like, no, any of the other symptoms are not related. Only if it's a headache, if you're seeing some little like floaters, it's neurological. If I tell my doctor, no, but I feel really nauseous, no, I'm going to send you to a gastro doctor because this has nothing to do with migraines. It has to do with IBS or something else. So they don't understand that we are not individual parts. We're a whole system together. So the fact that you mentioned that, yes, like your patient that goes slim lymph from one side of her body, or people that maybe get nauseous, or people that see floaters or see auras. Everything could be together to migraine. So thank you for explaining that so well.
Yeah, you know what? I think it's great that we have so many specialties today, right? We've got a specialist for everything, but we're starting to lose those physicians that look at the body as a whole. You know, unless you're going to a functional medicine doctor, and I might be a little bit biased, but that's where your physical therapist who specializes in this can be a great third party to kind of step back and take a look at the whole body. You know, we're trained from head to toe, and especially with every system in the body and how they all work together or how they all affect each other. So in physical therapy, we're used to looking at everything as a whole, and we can kind of step back and look at all the symptoms and say, okay, well, all of this stuff can be related, and here's how they, you know, relate to one another. So that's where I think physical therapists have really done a good job in the vestibular community as far as pulling together a team of people. Like, I have a neurologist I like to refer patients to if they're having migraines. I have an ear, nose, and throat doctor I like to work with. You know, I have a functional medicine doctor that we like to work with and send patients to. Being able to collaborate as a team to help a patient does so much more good for the patient's care overall
Holistic,
that they
holistic
improve.
approach. Yeah,
Yeah.
yeah. Danielle, which is interesting enough is that look at you, like you're so smart, so well aware about these things, so well informed. And I personally, I'd be more willing, if I was a patient of yours, I'd be more willing to listen to your advice than going to the actual medical doctor that told me at the beginning that it's like, no, this is all in your head. Like this is not real. And so they go to school for so long, and they have this title of doctor that they are so proud of, but they are so quick to dismiss patients. But look at you, like you you being involved in the vestibular world, you also work with other medical doctors to make sure that everybody's looking at it holistically. So
Mhm.
that's why I agree with you. Physical therapists, uh, chiropractors, like naturopaths, all of those different functional approaches have a more holistic view of things as a whole system, as a whole system.
And
So
to be fair, we have more time. So, you know, the doctors, our healthcare system is overwhelmed, right? I mean, you go to the doctors and you're lucky if you get 5, 10 minutes with your doctor, unless you're paying out of pocket, you know, cash
yeah,
for their time. So to be fair, you know, we get a full 45 minutes to an hour, and then we get to see the patient multiple times a week where we can really connect and educate and spend time with them. So I think that's where, you know, our profession has had the ability to really grow in the vestibular community. To be honest, with a lot of my vestibular evaluations, I could spend close to 20, 30 minutes just listening to the history, listening to what's going on. A lot of times, vestibular patients just don't feel heard. They feel
yeah,
like they don't have the time to tell somebody exactly what's going on and how it's affecting their daily life and how they feel. We have that time. And you mostly, if you give the patient a long enough time to talk, they'll tell you exactly what's going on. So I think listening is a great way to really approach that holistically, as well as decrease their anxiety. Sometimes people just need to be heard, and if they feel like they were at least heard and they got something out of the session, they immediately start feeling at least a little bit better because their stress levels are going down. They know they're not crazy, they're being heard.
yeah. Danielle, so let's put it as a scenario here. Let's say that somebody comes to see you, they haven't been diagnosed with anything, and they tell you that they've been feeling dizzy, that is not this spinning vertigo, but it's this sensation of being on a boat or something. That what will you be your next step?
So the next step is going through, just like I said, a really good history. We talk about family history, things that have happened in the past. And then I jump right into some physical evaluation. There's a lot that we can do in the clinic bedside without a lot of the big fancy equipment. So we look at their balance, you know, standing, eyes open, eyes closed, on foam. We look at their levels of anxiety during functional activities like walking and gait. We can do a lot at the bedside where we watch your eyes through specific tests to see if there's any indication that it's more centrally located issue in the brain or more peripherally located in the inner ears or the nerve going to the ears. We look at other components, like especially with my migraine patients, a cervical or a neck component is a really, really big problem. A lot of postural issues and cervical spine issues. So we do a very big evaluation. We take all of the information we take from that evaluation to kind of look at what are the biggest areas of dysfunction? What's driving all of this? And what else is going on? And how can we fix that? I like to practice also with infrared goggles. So these are just little video goggles. It's not virtual reality. You don't see anything while you're in them, but it allows me to view a patient's eyes in the dark, which will allow me to look at things a little bit more in depth and up close without the brain trying to hide and mask some of those symptoms. So my first day, as long as the patient can tolerate, we go through everything. I even check for Bppv in those patients that might not talk about room vertigo or room spinning vertigo, but we'll still check them because so many people with some sort of vestibular dysfunction are at higher risk for conditions like that. So you want to clear and make sure you've covered all of your bases. And then from there, you can start building that individual treatment program. One thing that I do like about vestibular therapy is not one person or not every patient that I have is exactly the same. You know, I can have 3 people walk in the door all with vestibular migraine, and they could be completely different. Someone might just be early on that needs to start moving and they're having some cervical issues and we clear things up there. I've had patients that come in that are extremely motion sensitive and can't even walk down the aisle of the supermarket because there's too many busy things going on. So, you know, being able to create an individual treatment plan from my evaluation is kind of fun because you start thinking of ways to work their normal daily routine into their exercises to make it fun and exciting for them.
Yeah. Some physical therapists, now that you mentioned the goggles, use different tools. Some of them use the virtual reality glasses. Other ones use this sophisticated weird chair that spins you like a spaceship.
Yeah.
What do you think? Do you think that these things are more to help diagnose rather than treat, or that they actually have some treatment options with this spinning chair, with the virtual reality, or do you go more for a hands-on, old school, let's say old school approach of doing the actual physical work?
Well, it's interesting, and this is entirely my own opinion. Every clinician and therapist is going to be a little bit different. I truly enjoy trying to keep it simple. You know, we have some different things here, like the neurosensory motor integrator, where we can do vestibular therapy, optokinetics. We have a balance board that go along with it. For my evaluation, I can pretty much do everything that I need to do with my own two hands and a couple of just really accessible, easy, cheap equipment. One of the things that I do like to use are those goggles, but there are some really affordable options out there now for clinicians who are just getting into it. So primarily, if it's just an evaluation, as long as I have my own 2 hands, a piece of foam, and a pair of goggles, I'm good to go. Some of the, now if you're looking more at a physician's point of view, you know, they like quantitative tests. So a lot of what we are looking at is qualitative. Is the patient symptomatic? I'm looking at eye movements, but the camera isn't measuring them to any degree. I'm looking at the direction of eye movements compared to what I'm doing. If we were an MD or somebody in an office who wanted to order testing, they might order something like a VNG, where they look at optokinetics. They put warm and cold air or water in your ears and make you really, really dizzy. They might put you in a rotational chair and spin you around a bunch of times. But I have found in the research, what I do at bedside is almost about 75% accurate compared to those tests. So why should we take a patient who's already suffering and put them through these horrible tests that might actually even trigger a migraine? Calorics, where they put the water in your ears, is actually known to be a migraine trigger for patients the next day following testing. So I think that keeping the patient as comfortable as possible while getting the most information from them, including how they feel during testing, is much more valuable compared to what a test or a computer might print out on a sheet. So I think this is especially important for any therapist who is dabbling in vestibular therapy or thinking about getting into it. You can get into it with literally almost no cost and be very effective and help a lot of people. So I think all the bells and whistles are great, but it's hard to convince a practice to spend that type of money and invest in that. And not all the time, like your patients can't tolerate that all the time. So those virtual reality goggles, we have a cheap pair from Target, right? That you just put a cell phone in, and I have a couple of free apps that, you know, we've picked up over the years that we can put patients in our VR goggles. We have a really, really great set of goggles from Vestibular First, who created one of the very first affordable models of infrared goggles that can be bought by almost anybody to start getting more people into treatment. And then otherwise, other things you can pretty much make up. You have these Brock strings for vision therapy, where it's literally just beads on a string. I have conflict boards where I took horrible self-adhesive wrapping paper or wallpaper that was really busy that we use for working with patients. And, you can pretty much make a whole toolbox of things from things right in your own home. So although the bells and whistles are great, sometimes I think it works against our patients, and keeping it simple can be really, really golden. It can be key.
Yeah, you did touch a very specific point about the vision therapy. That's huge. I started doing vision therapy because I couldn't focus when this thing started. I couldn't focus my eyes with movement, or I couldn't even reading or seeing our cars passing by. It's like my eyes couldn't track it properly. So I started doing vision therapy, and it helped stabilize my eyes, my gaze. So so good point that you brought that up, because not many people know about it. So I'm very, very happy that you brought it up and that you're well aware about it.
Yeah. Now with vision therapy, we can do a little bit in physical therapy as vestibular therapists. We dabble in it, but there are vision therapists who specialize in vision therapy. And sometimes it's really, really key to find that specialist. I had spent an entire morning with a group up in Maryland in Bethesda, who this is all they do. I mean, people fly over from all over the world to work with them, to work on vision therapy, like professional athletes even. And there was so much to it that I did not realize. So it's important to kind of know our limitations as a clinician and refer our patients to the best possible, the best therapist possible that can help them out. And vision therapy is one of those specialties where I am very happy sending my patients to someone who specializes in it, because it can go in depth, man. It's crazy.
Danielle, first of all, thank you for doing the vestibular challenge, the flamingo challenge.
I think I still owe you a half.
You owe me one leg. but I appreciate you for the support. That was great. A lot of people tried it, and not as easy as it seems, right? Like a lot of people that.
No, I've got a healthy vestibular system, and it's hard. I'll admit it. It took me a couple of takes.
Yeah. A lot of people were telling me that. They're like, how do you even do this with your condition? I'm like, just practice, and it's what it takes. Daniel, I want to talk to you about the vestibular nerve. Apparently, is very closely related, and I just found this out this week. Very closely related to the vagus nerve. Apparently, no, it's the how is it vagus nerve? Vagus.
There is a vagus nerve, yeah.
Vagus nerve, yeah. Apparently, that runs from our head all the way down to like our legs or something like that. Apparently, it's very influential, even with digestive systems and all of this. I didn't know that apparently it works apparently really connected with the vestibular system. So I saw a therapist that was telling me that if you stimulate the vagus nerve with whether it is with gargling, like with water in your throat, or with a stimulator in the back of your neck, or with cold water, it could help the vestibular system kind of like stop to be in overdrive, kind of like give it a little bit of a break. What do you think about that? Are they connected? Are they linked? Are they feeding of each other?
That I'll have to do some more research on and get back to you. But I do know that, so the vagus nerve also runs down to your diaphragm. It's really important for breathing. And you can calm down part of your nervous system that becomes too worked up, especially under a lot of stress and anxiety, by doing a lot of diaphragmatic or deep breathing and mindfulness practice. So I do know that working on a lot of that will also help those vestibular systems or symptoms. I do a lot of mindfulness work with my patients, especially when they're, right in the beginning and they're really worked up and they're very type A or an anxious patient. We'll open up a couple of free apps like Insight Timer, where it kind of works people through guided meditation and breathing to kind of calm that system down and decrease the excitability of the nervous system. But I will do my research and I will get back to you on that. It sounds like a good blog post I can kind of put up and dive into. I'm constantly learning new stuff every day. So thank you for pointing me in that direction so I can explore that rabbit hole.
Yeah, of course. When you mentioned breathing, so I started doing Before this, I never did yoga in my life. I was like, I don't do yoga. That's for hippies. I don't like it. When I got this and somebody say, hey, maybe yoga might help you, I started doing it and I loved it. And now it's part of my daily routine. I do it twice a day. It's great and it's helped me a lot. But also what you mentioned about breathing, I started following a guy called Wim Hof. I don't know if you ever heard of the Wim Hof method.
I
He,
haven't.
so it's a guy from the Netherlands that developed this breathing system that calms your whole system down. If you find him, if you Google him, Wim Hof,
Okay.
the Wim Hof breathing method, it helped me a lot because yes, it's a way to decrease the level of excitement or stress or anxiety that you may have on a daily basis. So you might want to take a quick look at that one. It's,
I
it's, it's
will.
it's been very helpful for me. And he also believes in cold therapy exposure. So when you expose yourself to cold water for a couple of minutes every day, just to help your system kind of like, whew, like stop the excitement and just bring you back to basics. So
I like that.
yeah,
I'll have to look them up.
yeah. Danielle, where can people find you?
Oh, so I have a little website for those little models that I developed. It's called Vestibular Today. It's at www.vestibular.today, or on Facebook by the same name, and on Instagram. And with this whole pandemic, we've been working hard to try to develop some additional videos that kind of give some quick tips, some educational stuff, and we're working on some other things coming up, especially for Steps to Balance with the Vestibular Disorders Association. That's coming up in May. So I'm hoping to do a live Q&A during that week for anybody that might have questions about their symptoms or about vestibular dysfunction, just to continue to raise awareness and keep putting it out there, especially like what you've been doing. I mean, all your work has been fantastic.
Thank
Keep it up. We need people like you to keep putting the word out, because this needs to become the new normal. We need to make vestibular issues visible. We don't need people to feel invisible anymore.
Yes, thank you. Thank you very much. I appreciate that. Danielle, my last question to you is, when people start feeling these symptoms or they are new to it, they often fall into depression due to the anxiety, the neglect that they feel that they are not being heard, like you mentioned. Uh, Even people, and I experienced it myself, had a really dark moment of suicidal thoughts because we think, hey, I don't want to spend the rest of my life being dizzy. What would you like to say to them in order to encourage them and motivate them and tell them that it will get better, that it will be better? What would you like to say to people
Yeah.
like that?
There's always hope, and there's always light at the end of the tunnel. And there are so many things out there now where we can connect with people, even virtually, including support groups. VITA, or the Vestibular Disorders Association, at vestibular.org. They have a whole list of in-person or virtual support groups that you can go to and just connect with other people who are experiencing what you're experiencing. Facebook groups, there's YouTube channels, there's Instagrams, you know, really try to connect with others who are going through what you're going through, so you feel understood, you feel like you're being heard, and there is hope. You can get through this, and that there is something that's going to get you back to a new normal. There's always hope. There's always a light.
Awesome. Thank you very much. And I hope we can do this again sometime. And
Absolutely.
I really appreciate you taking the time for helping us out and for providing hope, and keep up the great work. And I'm amazed, like mind blown by how knowledgeable, how smart, how kind you are. Like you have this thing about your personality that you seem to very, very kind and compassionate. So that goes a long way, especially on a healthcare professional.
Well, thank you, and keep doing what you're doing. We need more people like you putting out the word, so keep it up. I love following all your videos.
All right, awesome. Thank you very much.
Thank you.
Bye, Danielle.
See ya.